My name is Donna Walker-Kuhn. I am Senior Advisor of Diversity, Equity, and Inclusion at New Jersey Performing Arts Center. I'd like to welcome all of you to our Kwanzaa Virtual Family Festival. The theme for our panel is Health and Wellness in the Black Community. And we are so pleased and honored to have representatives from the Divine Nine New Jersey chapters, which are the Black sororities and fraternities that are addressing this critical topic. And we extend our deepest appreciation to our panel for taking time out of their busy schedules to share their valuable knowledge and experience. We also recognize this historic contribution from the Divine Nine, demonstrating unity, which is one of the 7 principles of Kwanzaa, a perfect example of uniting to build community and awareness. I also would like to thank the Divine Nine for their philanthropy, as demonstrated by their donation of their honorarium to purchase tickets for our youth to attend a performance of Hip Hop Nutcracker at NJPAC. That is fantastic. We thank you for that. Also, our apologies to the AKAs for the incorrect colors. We know that it should be pink and green, and it will be corrected on Monday. So it's important that we take care of all of these details. Our Kwanzaa Virtual Family Festival is produced by NJPAC's Community Engagement Department, led by AVP Aisha Marable. Also, I'd like to thank Dr. Michael Straker for his careful and thoughtful curation of this panel. Lastly, our Hip Hop Nutcrackers performances for today have been canceled. So if anyone online watching was planning to come, please don't. We don't have a performance for you today, but we will let you know when it's going to be rescheduled. I'd now like to take this moment to introduce our moderator, Dr. Sancha Gray. She's the Senior Vice President for Entrepreneurial Education Initiatives at Keene University. As an educator for over 20 years, Dr. Gray's work has been sharply focused on creating equitable experiences that change the trajectory for all people, with a specific focus on Black and Brown children and their families. She's a proud member of the Alpha Kappa Alpha Sorority Incorporated, Omicron Xi Omega chapter, the president of the National Coalition of 100 Black Women, Central New Jersey chapter, and president of the Greater Asbury Park Democratic Club. Proud wife of well-known gospel organist Floyd Gray Jr. and mother of Christopher and Sierra Gray. Welcome, Dr. Gray. We're delighted to have you. Thank you.
Good afternoon. It is my pleasure to be with you all this afternoon for such a timely and worthwhile discussion. I thank you so much, NJPAC coordinators, for taking the time out to make this a priority and a discussion within our community. So without further ado, let me again go and say thank you to the wonderful panelists that have been convened from the Divine Nine. Certainly we have a lot to talk about. And so I will mention their backgrounds individually as we talk and as they are talking and addressing some of the conversations. We want to jump right in because we want to have as much time as possible, specifically when we hear matters around how the spike in numbers is occurring with more COVID positive cases in the state of New Jersey. And because of that recent revelation, I'd like to have the panel talk specifically about what are we seeing in the ER room. I know Dr. Karma Warren, a member of the Delta Sigma Theta Sorority Incorporated, is also a board certified emergency medicine physician. Dr. Karma, can you tell us a little bit about what that's looking like?
First of all, let me just thank NJPAC for inviting me and allowing me to represent the devastating sorrows of Delta Sigma Theta Sorority Incorporated, especially my chapter, the North Jersey Alumni chapter. But I think actually there's Dr. Charles, who's also an emergency doctor on this panel, my D9 brother, Kappa Alpha Psi brother. We can honestly say that from 2020 to now, there has been about 180-degree change. I remember back in 2020, when I was coding people left and right, I mean, literally speaking to you one minute, and then the next minute calling a code and trying to save their life. I mean, it was scary. In all my 20 years of practicing, it was like a horror show. I had never seen anything like that. But I can say that because of vaccination, right, the number of COVID patients that we see in the ED right now has significantly dropped. Now, when I first signed up to do this webinar, I want to say maybe I saw one, maybe two. I mean, and that's pushing it, COVID positive patients in the ER. But just in the last week and a half, and probably due to the, Omicron and the holiday, we're seeing anywhere from 6 to 8 COVID positive patients in the ER, and they are actually sick, right? But I will say those that are sick are the unvaccinated patients. So that should be reassuring for those that are vaccinated that it's actually working, right? Those that are becoming positive and that we are seeing in the ED basically have minimal to no symptoms at all. If they do, it may be as far as like a flu, but it's definitely made a change from 2020 to now. We're also seeing the patients that are a little bit more sicker than they were before the pandemic. See, when you come to the ER, we rate you on 1 to 5 based on how serious you are. I have seen nothing but 1 and 2 patients, and it's usually because, and I'm not blaming anybody. During the height of the COVID, most people just didn't want to come to the ER. Like, who would want to come to the ER and be exposed to COVID? So basically, they stayed at home, ignoring like the chest pain, the abdominal pain, the headaches, the shortness of breath, and allowed their sicknesses to continue to worsen, right? To the point where they couldn't ignore the symptoms anymore. And so they're showing up in the ER now. They're in full severe congestive heart failure, which means they're short of breath. They're having heart attacks. Their diets have been poor over this whole time. So their blood sugars are out of sorts. They haven't been able to see their doctors or refill their medications. So their chronic conditions like high blood pressure, high cholesterolemia is out of control and manifesting as strokes and also just conditions that need us to see them immediately when they come to the ER. And, last I could say, the other things we are seeing in the ER is what most people are now knowing about long hauler syndrome. And these are the patients that are once tested positive for COVID, but they're no longer infective, but they're still continuing to have symptoms, right? And these symptoms can range anywhere from the chronic cough to extreme fatigue, chest pain, shortness of breath, and this COVID fog, which we talk a little bit about. It's kind of scary because it's like you can't remember your short and your long-term memory. And we just don't know how long these symptoms are going to last, especially since we're seeing them in our patients long after their infections are over. So the ER is filled up with all different types. We got the COVID positive, we got the long haulers, and we got those that are very sick.
So that is a significant update in terms of the impact. Can we speak a little more globally about how the pandemic has impacted the Black community when we transition away from that ER setting and ER experience?
Well, you know what? I know my brothers and sisters got a lot to talk about that. So I'll just quickly say, the pandemic caused really put on forefront the social and health inequities that exist in our communities. And so you couldn't pick up like a magazine or watch a television news program without seeing all the issues that were happening in communities of color. So, I think my brothers and sisters are going to break that down.
Yes, one of our sisters from the Sigma Gamma Rho Sorority Incorporated, Reverend Dr. Anne Marie Bency Addison. I know you as an RN have a lot that you can share there as a doctor as well in the medical field. Can you enlighten us about that impact in our community?
Good afternoon, and thank you for the opportunity to contribute. In my understanding of women's healthcare reproduction, as midwifery is my specialty, I see a lot of issues with vaccine hesitancy around women of reproductive age. The problem is because they are healthier and therefore are not as apt to contract the COVID virus, and because they feel that they don't want COVID to impact their fertility, they're being quite hesitant in getting the COVID vaccine. But what I'd like to remind our brothers and sisters is that the old adage of when America gets the cold, that we get pneumonia. We come into our reproductive years at a medical and economical disadvantage, not because of who we are, but because of what we have been subjected to. And so as such, women in their reproductive years, especially when they are pregnant or newly delivered, are at an increased risk of getting the COVID virus, and they are at an increased risk of getting sicker because of their debilitating health status that they came to the pregnancy with. Taking COVID out of the picture, we are already 3 to 4 times more likely to die in pregnancy or have significant morbidity issues because of the pregnancy experience. That when we compound that with having the COVID virus, that it further impedes our childbearing efforts and our efforts at mothering. So I need us to take it into consideration that all of the advising bodies, ACOG, ACNM, the American Society for Reproductive Medicine, have all suggested and highly recommended that at any stage of a pregnancy or preparation thereof, or even early after delivery in the postpartum period, that we do get a COVID vaccine.
Critically important and so necessary, especially as we start talking about COVID care and how testing sites are popping up more frequently, and having the access to them is critically important. Sora Kardai, can you speak to that about how the access or lack thereof is having an impact in our community?
Absolutely. Can you hear me? I'm just testing my mic. Great. Lovely to be here, Dr. Kordai Kodo of the first and the illustrious ladies of B Alpha Kappa Alpha Sorority, the Omicron Xi Omega chapter. I have served as a health and wellness chair throughout my AKA career. And one of the things being a physician that we're seeing is fear and lack of access. I am a podiatrist, board certified, and what we're seeing is diabetic foot. People are losing limbs left and right. Just was in St. Barnabas today talking to a sister about losing her foot. The pandemic, we've seen a 10.8% increase in amputations. Why? Because hyperglycemia. We're all home, we're baking, we're sharing recipes, and not having good control of our glucose is causing problems with something called adenopectin, which is with fat metabolism. And we're not metabolizing. Our 3-month check for our hemoglobin A1C, as we should be under 7 if we're diabetic, is in the 10s and the 12s and the 15s. And little spots that people see, they ignore, little cuts they ignore, and then it becomes a gross problem. And so we're doing a lot more amputations than prevention. Also, as a breast cancer survivor, with my advocacy talks with Dr. D, we're seeing definitely the disparities in healthcare with a significant increase of patients who just weren't going for mammograms and ultrasounds. Why? We're afraid because of COVID. And instead of coming out with stage 1, maybe stage 2, we were coming out with end stage cancer and stage 3 cancers. And so Black women already have a 40% increase of dying from breast cancer than our white counterparts. And now tag that onto COVID, tag on some of our social situations, single parents, taking care of our adult parents, taking care of children that may need help, is preventing us from going and access. And lastly, clinical trials that may benefit us. We already have distrust of the medical system. Black people, we suffer with PTSD from that. So a lot of time it's information, it's fear, and obviously even the questionnaires that we have to fill out for these clinical trials are like 20 pages. Who has time for that? So a lot of research is not even being done on us.
Wow, those are really significant stats that you brought to the forefront. The points that you raised about information and fear continue to be areas where panel discussions like this afternoon are critically important, because the information is changing daily. So we have to make sure that we stay informed and educated at all times, because ignorance and ignoring facts really is having a significant impact. That being said, let's talk a little bit about how the lockdown has also had an impact beyond some of what you mentioned in terms of the obesity, and go a little bit deeper in talking about the impacts of being at home as well. So Dr. Flynn, would you like to jump in on that part and talk to us a little bit more about that?
Definitely, definitely. And good afternoon, everybody. Thank you for having me be a part of this panel. Like was said in the reel before we started, I am a pediatrician in Bloomfield area. And one of the things that I've seen in a number of my patients, especially after this year and a half of being, kind of quarantined for everybody and at home, is that a dramatic increase in cases of obesity and overweight children. I've seen upwards of 50 pounds of weight gain in the last year, which no matter how old you are, is not something that anybody should be doing. I think what we don't or didn't take into account, with this lockdown is the natural barriers that leaving your house, going to school, going to work provides you in regards to, your eating habits. Being at home and being, working from home, going to school from home virtually, you don't really think about that. You're just like, okay, I'm hungry. And so, that whatever random food you could think of that may have been sitting in your house for who knows how long that you haven't eaten because you were never there to eat it is now easily accessible to you. And you can continue to do your schoolwork and you can continue to work and just keep eating. And every time you get hungry, you just go to the refrigerator or you go to the pantry and you eat and you eat and you eat. And the next thing you know, you've gained 10 and 20 and 30 and 50 pounds. I mean, I've had patients who have been recently diagnosed as diabetic because of this, and so, I think that a lot of the information that was disseminated, I think from the beginning of this pandemic and as far as being locked down, while helpful, didn't necessarily address certain, aspects of just life in general, thinking about, okay, continuing to eat a healthy diet, continuing some type of, activity or exercise. Yes, granted, nobody really wanted to go outside, because you didn't want to potentially contract something from somebody else. But there are things that you could still do in your house to maintain yourself, to try to, stay, at whatever weight it was that you were when you started, or, just to be healthy overall and not just eating everything that's in sight because you wanted to, or because you felt like you needed to. And so I think that has had a tremendous effect on the health of not just our children, but also adults as well, making sure that we have to live healthier than we were. I mean, it's not just about preventing infection, it's about preventing everything else that can go along with it.
Dr. Flynn, I smiled hard while you were talking because I also looked in the chat, and I think a lot of what you're talking about and what I saw in the chat, we can all echo those sentiments about just mindless eating. And I too put on probably more than the 19 spread that many people are talking about. And so to that point, while I chuckle, that is a very serious matter. And we do understand the necessity in being mindful and having mindful eating practices. So thank you for bringing that to the forefront so that we can begin to think more thoughtfully and more intentionally about eating and when we're eating, and of course, what we're eating. In addition to the eating and that mindful practice, we know that mental health and battling alcohol and drug addiction continues to be another concern. During the pandemic, one of the essential businesses that was open were liquor stores. And so I'm sure there's a significant correlation between an impact that we may be seeing. And I want to open that up to members of the panel who may want to chime in that we may not have heard from yet to speak to that.
I just wanted to add one thing just in regards to what you were saying,
Please.
The mental health aspect of it. While obviously I'm not in law enforcement, I do have many, fraternity brothers and friends who are. And one of the things that was definitely a huge increase was the number of domestic violence calls that police were getting. Obviously, people are not necessarily used to being around their significant others for that extended period of time. And so that caused a lot of problems, not to be joking about it, but it's the mental aspect of being locked down into your house for extended periods of time when you're not used to that. The change from doing everything to then not be able to do anything is something that not a lot of people were able to handle. And thus you started to see a lot more, cases of people just kind of losing their minds. And then unfortunately taking that out on their significant others.
Yeah, definitely as a hub for a lot of mental illness emergencies, we saw a lot more patients that were coming in with depression, suicidal ideation, domestic abuse. So the ER did see a lot of patients like that as well. So, I mean, by nature, we are human beings. We need human touch. We need to be around people. And so you're talking about a time period where you just didn't have that. And so the obvious effect is going to be where we're going to need to have some other interaction with others. And when you don't, that's what comes out.
There we go. Yes, and as you know, we make sure that we were always telling our diabetic patients and non-diabetic patients and patients with peripheral vascular disease, poor circulation, that they have to move. Some of the challenges are when you live in an apartment or studio, especially if you're a New Yorker, where do you move to? If you only have so much, room, then you have your neighbors above who may be moving too much, and you're hearing da 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 da. And that is an effect on your mental health in and of itself. Trying to do the right thing, but being limited by the space that you may have. And so, some of the newer apps that are out for free, Fit On and this and all the YouTube videos, people are trying, I think, to get a lot more conscious about it in the confines that they have. And these free apps that are out there, I think, are a good option when you're limited, especially if you can't go to the gym for a variety of reasons.
Absolutely. I see in the chat, someone's also mentioned about a nutritionist. And yes, there are a lot of resources. And I believe with all the doctors on the panel, they may be able to provide us with some additional supports. Dr. Derek Wallace, I know you have some things you want to share with us.
Yes. Hello and welcome. And I'm happy to be here and be part of the panel. I'm Dr. Wallace. I'm a member of Kappa Alpha Psi. So I'm an otolaryngologist, which is ear, nose, and throat specialist. And some of the things that I'm seeing, certainly in our community, is changes of smell and taste, things that are not life-threatening but have a significant impact as far as how we enjoy food, our diet. And sometimes these things are quite distressing to patients. So you imagine you lose your sense of smell and then food doesn't taste properly and it's hard to eat. Some people come in and they report changes in their sense of smell. Basically things smell rancid or they don't taste properly. And this is something that is affecting a lot of patients with COVID-19 after the initial effects of the virus. So one of the things that we are directing patients to do is to actually exercise their sense of smell by using essential oils and smell kits and things like that to kind of stimulate and bring back their sense of smell and basically restore their sense of smell and taste. And I think the prognosis for this actually is very good. So for those of you who have had COVID and are affected by this, don't despair. There is definitely a chance for recovery from this.
As a former superintendent of schools, one of the things that I was specifically challenged with as a leader of a district that was majority Black and Hispanic students in poverty was the fact that the privilege of socially distancing was not afforded to them. And oftentimes it placed them on the front grounds, right out front and center during the height of the pandemic, where others were able to work remotely and work virtually. These students found themselves in high contact, high touch communities and services and working at jobs. So when we talk about those kinds of communities, I'm not talking about just one, we know that this is an impact across the state and country and globally, where we are seeing the impact of when individuals were not able to socially distance. And I know we've talked about the impact on our Black community, but if someone would like to expand a little bit more and talk a little bit about the fact of not being able to socially distance, not having that privilege, and as it relates to food insecurities, because we are unpacking a larger issue of mindless eating. We are talking about the need for a nutritionist, but at the same time, food justice and food insecurities is a major, major piece of it. And so I want to open that up to the panel for further discussion.
So I'll jump in. My name is Vesta Godwin Clark, and I am the Executive Director of St. James Social Service Corporation here in the city of Newark. I am a proud member of Zeta Phi Beta Sorority, Eta Omicron Zeta Chapter. So as one of the largest providers of food here in Newark through our emergency food pantry and our soup kitchen, the pandemic hit us in a way that we could have never, ever expected. I've been in this business doing food for over 22 years. And on an average, we would serve about 100,000 people annually. When COVID-19 hit and the pandemic, we as an agency were the only provider, nonprofit provider of food that never ever shut down. So that meant other food pantries that normally are run by volunteers, churches, seniors, they all closed, and not just in the state of New Jersey. So we saw people coming from New York and Pennsylvania looking for food. So from 100,000 people annually, within a 2-month period between April 1st and June 1st, we saw over 60,000 people. So that was because of the shutdown. People couldn't go to work. If they couldn't go to work, they had no money, they had no income. Those who became unemployed, the unemployment system was backed up for months and months, where you had people who they had no money, so they applied for SNAP benefits. That system was backed up, so they came to food pantries. They came to us. So we would see about 500 people a day. This included entire families because we have children who normally would go to school and they would get 2 meals. Now they didn't get those meals. So how is the family going to survive? We literally would have carloads of families to pull up to get both lunch and dinner in our to-go plates, because we as an agency had to learn how to provide our services differently. We have a dining room, but because of COVID, we couldn't serve in our dining room, and we still don't serve in our dining room. But to see those families come to us for a hot meal was just heartbreaking. And normally we get the majority of our food from the Community Food Bank of New Jersey. So all of a sudden, the world realized that people need food to survive, and everyone couldn't go to the grocery stores to get it. So we were literally we received over 700,000 pounds of food in 2020. We were getting 18 pallets of food delivered every day, where we could provide as many fresh vegetables and fruits as we possibly could, because as the panelists here have already discussed, with obesity, the problems in our community with diabetes, we tried to provide as much as we could. And then now the cost of food has gone up. When people could receive chicken from us, they were like, oh my God, we can't find chicken, we can't afford it, we can't find it. So as a nonprofit agency, it's our job to really try to do the best that we can to provide and to continue to provide food as long as we can, because even though people are being hired, the joblessness rate continues. So as long as people become unemployed, they're still going to need services like us. And over 40%, we saw a 40% increase of people who've never ever attended or had to go to a food pantry or a soup kitchen in the past. So I'm really grateful that we are being able to do what we do, and the other pantries have opened up to be able to help to serve the community. But it's definitely been something. And one of the things when we talk about mental illness, we have a lot of our clients who we know have been on medications for mental illness, but because of the pandemic, we've seen so many of our clients that we know are under medication that are off, they became off their meds because they didn't have access to their doctors. And that's something else in terms of mental illness in the community that is really something important.
Wow, thank you so much for unpacking that. You covered a lot and you touched on the different levels of concern. You know, obviously the first one being food insecurity, we have to eat. But then you touched on the food justice and providing whole foods, quality foods, fresh produce, when we know in historically marginalized communities of color, in poverty, we know that quality and access to high quality whole foods is an added challenge. And then, as I saw in the chat, we also know about the logistics issue here in our country and just the ability to move that and make it available. There's also a lot of distrust that we hear brewing and continues to brew through social media, through a lot of different avenues. And I don't present social media as the devil, right? But certainly we know that the way data is collected, we can get messaging that specifically targets a specific preference that we might have. And so I want to kind of transition into the impact that that's had on our community as it relates to distrust with vaccinations and booster shots, and what you may be seeing, hearing, and experiencing. Dr. D. Wallace?
Yes, so that's a big issue in our community. First of all, the distrust of the healthcare system in the United States of vaccination is something that is warranted in our community. You know, initially, when I thought about it, I kind of poo-pooed it. I was like, why the distrust? But when you really look at it historically, you know, we talk about the Tuskegee experiment, and everybody knows that. And really, you know, looking back at it, that experiment didn't end until 1972, which is not that long ago, you know. Other things that took place historically in the Black community, forced sterilization. People don't talk about that, but that's something that's real. It hasn't been acknowledged by our government. The early experimentation, obstetrical experimentations done on enslaved women. These things are in our historical, you know, memory. And so the distrust is real. It's out there in the community. And, you know, I've had the discussions with my friends and family, and people are hesitant. And so we have to, first of all, acknowledge that exists. But, you know, we have to educate people on the safety of the vaccine. Yes, it's a newer vaccine. It's one that, you know, had emergency use authorization, but it's also been shown to be very effective. Okay, the efficacy is about 80% in terms of preventing severe illness and hospitalization. We do know that the efficacy does wane over time. After about 5 months, the efficacy goes down to about 40 to 50%. So that, hence the importance of the booster shots. And it's important for people to know it's not just enough to get the vaccine, but you have to follow up, and you need to get your booster about 5 or 6 months afterwards in order to maintain your immunity. You know, the jury is out on the COVID variants, especially the new one, you know, Omicron. We don't know how effective the vaccine is, but we also don't know how severe the Omicron variant is. So, you know, I think the only way out of this pandemic, which is now endemic, is vaccination and reaching this so-called herd immunity, which we cannot reach without vaccination.
So Dr. Rodriguez, if you could also just talk to us a little bit as well about how the pandemic has uncovered a lot of these disparities and inequities as it relates to our community.
Yes, thank you. Well, first of all, let me say, as a proud member of Iota Phi Theta fraternity, Incorporated. It's my honor, it's my pleasure to be here with my Greek community as part of this important panel. So many great things have already been said. I think that there's several points that I want to highlight. One is that it is a fact, and I'm here to spread facts and not fear, but it is a fact that Blacks and Hispanics were disproportionately affected by the COVID crisis. This is national data. This is nationally available data. And Blacks and Hispanics were more likely to be infected by COVID, be hospitalized by COVID, and die from COVID compared to non-Hispanic whites. So I think we have to realize that we are at risk. We are more at risk. So we need to be more educated, take more precautions, and take more empowerment of trying to protect ourselves from dying. There's several reasons for the high risk among Black communities, and this is not driven by any genetics, in my opinion. It's a mixture of the many difficulties that are faced by Black and Latino communities, many of which have been already described by our panel. But these difficulties, these mixture of difficulties and disparities really increase the risk of COVID infection, hospitalization, and death. One of the risks that hasn't been mentioned that I want to say is that there's a higher burden of medical conditions that increase risk of COVID infection and COVID severity in our community. High blood pressure, obesity, heart disease, and diabetes. These are all risk factors for more severe COVID and death from COVID. And they're more prevalent among Black communities. So we need to be aware of that as a community, and we need to be aggressive in treating our patients and also having our patients take care of themselves. There's disparities that have been mentioned about working in, more of our communities are working in service industries and essential jobs where people cannot take sick leave or work remotely. There's more people in our Black and brown communities taking public transportation to work, where there's less health safety and less opportunity to social distancing. Similarly, there's people in Black and brown communities living in housing conditions, whether it be crowded housing or housing that's unsafe from a health perspective, where social distance cannot be prioritized. Lack of access to early COVID testing, lack of access to advanced COVID treatments. These are more disparities that are experienced in Black and Latino communities. And there's lack of culturally appropriate health education materials for our Black and Latino communities. And that's why we're here. We're here to spread the message in a way that we can our communities can better understand and digest. And I think the problem of distrust is a huge problem that has put our communities at risk. It's been said already that vaccination is probably the best means of overcoming this pandemic, especially for our communities. It's the best mean of overcoming this pandemic. I think the factors of vaccine hesitancy have to be overcome. We have to work to overcome them. The long-standing mistrust in the healthcare system. I think we have to encourage all of our patients and all of our community to at least have a discussion with a healthcare provider that you trust, and at least talk about the possibility of getting vaccinated. And if they're vaccinated, talk about the possibility of getting boosted. There's a lack of knowledge of the efficacy of the vaccine. Yes, you can still get infected if you're vaccinated, but you're less likely to get a severe infection, be hospitalized, and less likely to die. And I think that that's really the key. There's myth about the adverse effects of the vaccines. Some of those have been mentioned. The vaccines do not cause female infertility, and they do not cause a positive COVID test. You cannot get COVID from the vaccine itself. So again, we need to realize that we are the communities at highest risk for severe COVID and death, and that we need to all be protected as a community. You know, the benefits of vaccination go beyond ourselves. Being vaccinated help protects not just ourselves, but our communities. And I think, again, that this is an opportunity for facts, not fear. This is an important opportunity to appreciate good health. It's an important opportunity to appreciate taking better care of yourself, preventing cardiovascular disease, to make sure that your blood pressure, your cholesterol, your diabetes is controlled. And again, an important opportunity to get vaccinated and get boosted.
Thank you so much. When I heard you mention social distancing, I said, I have to make sure that we get Brother Michael here from Phi Beta Sigma Fraternity Incorporated to chime in on that piece. We want to make sure that your voice is here as well.
All right, good afternoon, and thank you for that question. Again, my name is Michael Murray. I'm a registered case manager. I'm a supervisor at one of the hospitals here in Arkansas. When we talk about social distancing and things like that, my role is to help transition patients from the hospital to home. And what we encountered a lot of times is that people living in multi-generational homes didn't really have the ability to safely social distance at home. You had families at home that we want them to be completely COVID-free before they come home, because there are 8 people living in the house. My elderly great-grandmother, who's 95, that we provide care for, is in our house home. So, I mean, here in Arkansas, we had to open quarantine facilities for patients to transition from the hospital that couldn't safely quarantine at home. Did a little research. There was a survey of like 20,000 people, and based on social distancing, and about 28% of them said that they couldn't social distance because their non-essential job was deemed essential by their boss, and they didn't have the necessary resources to social distance at work, and they had to go to work or face unemployment, lost wages. So I think the hospital impact, trying to move patients through the healthcare spectrum, was tremendously impacted prior to the vaccination. It's lessened a little bit, but as we get ready to experience a surge again, we're starting to feel the effects of those things on the hospital side. So I know we're going to talk about encouraging people to get vaccinated, but I'm going to get mine in now just in case I don't get to in the end.
Thank you so much for that timely commentary. Definitely important, definitely something that I've seen and experienced with students that had to be on the front lines. I mean, they were there, and they are just getting vaccinated to date. I see also in the Q&A session, Brother Alan Daniels, representing Phi Beta Sigma Fraternity Incorporated. He mentions how the sexual and child abuse is increasing at alarmingly high rates during this pandemic, and this is a nightmare for law enforcement professionals. Thank you so much. So true, and definitely we have convened this expert panel to speak to you about the impact of wellness in our community and health. But certainly we know that our participants are also very skilled and vocal and experts in those respective fields as well. So we thank you for your comments as you are typing them in. We are going to transition to question and answer. I see there's a question here for Dr. Warren. Are you seeing a realization of the need for vaccines when patients come into the emergency department? Are they willing once they come in, and does this change their loved one's viewpoint? That's a critical piece. We've heard a lot about the distrust in our communities, rightly or wrongly. We know that it exists, but that's a very important distinction to make. Is it changing the viewpoint of the loved ones that are coming in? And while it was directed to Dr. Warren, it will be open for others to speak to as well.
I will just say, That's a very good question. If I had to put a number on it, I'd probably say 50-50. I find that those patients that aren't vaccinated, I'm really not able to convince them to get vaccinated. And those who are having a family member that's very sick or they're very sick, they want to get vaccinated, but it's too late at that time. You're going to have to wait until after the infection has subsided. But otherwise, yeah, no, I don't think that I've seen a change, but I will say that the patients that aren't very sick that are coming in the ER are the ones that are vaccinated, and the ones that aren't vaccinated are the ones that are very sick. So if you could pick up anything from that, get your vaccination and get your booster.
Okay, Dr. Cordai, please share some additional comments with us.
One thing that we're seeing as well is that breast cancer patients were terrified to get the vaccination because what they were doing, instead of waiting, were getting the vaccination and then they were having their lymph nodes become inflamed. And as a survivor, once you feel your lymph nodes, you go into crazy mode, like, Lord, I got cancer again. And so what the Society of Breast Imaging is saying now is that if you have breast cancer and any types of cancer, you should pretty much wait 4 to 6 weeks and speak to your oncologist to make sure that your treatment, chemo, radiation, that it's calm, quote unquote, before you get the actual vaccination, so that people are not delaying it, but not doing it too early where they're getting an adverse reaction and thinking that it's a result that the COVID vaccine is causing them to have issues with their cancer. So 4 to 6 weeks and speaking to your oncologist.
Thank you. We have a question in our chat from Joanne Williams. Is there a great concern if you had your 2 COVID shots, but overdue for the booster and have a pre-existing condition at age 83 in a nursing home? Dr. Cordai, you touched on that a little bit, but I know we have others on our panel that would like to also weigh in.
Well, I'll start that off. Age is one of the strongest risk factors for COVID infection and death. So definitely, I think that the question was referring to an elderly person. I think, the elderly in our community should be one of the first to get vaccinated, and should be also one of the ones who are prioritized for a booster shot. And there was a mention of a pre-existing condition. I mentioned earlier that heart disease is, as well as high blood pressure, diabetes, are risk factors for worse outcomes with COVID, and also for COVID infections. So I think having those types of pre-existing conditions should prioritize and should, send a message of importance to that person to get vaccinated and get boosted. For certain.
Thank you so much.
Also, I'll just add our elderly patients, their ability to mount an immune response is not as vigorous as someone who's younger. So the importance of obtaining a booster and obtaining it in a timely fashion is something that has to be considered in older patients.
And as I look in the question and answer section, Michael Murray, can you speak to, because you responded in writing, but it's an excellent question regarding getting the flu shot after the booster in case of a reaction, or can you do both?
Yeah, I think the question was, should you get the booster shot and the flu shot at the same time? I know there has been literature out there and studies and people actually getting the flu shot and the booster shot at the same time. What I encourage that individual that asked that question to individualize it to themselves. If they normally have a pretty strong immune response to a vaccination, then I definitely would consider getting them separate, not at the same time, just to not put themselves into a situation where they're down and out for several days.
Thank you so much for your response there. The question regarding a nutritionist continues to come up, and I just think from a standpoint of healthy living, having a nutritionist and making sure that we have informed information in our community regarding that is key. However, is there someone on our panel that would like to speak directly to the need? I know we have Dr. Vesta here from Zeta Phi Beta Sorority Incorporated. So please feel free to chime in on that, as you've done such remarkable work around food justice and food insecurity.
Well, doctor is not me, but there are a lot of programs that offer free nutrition programs. I cannot personally refer anyone to a nutritionist, but there's a lot of information on the website. And I would say if you go to SNAP Ed, that has a lot of information at state programs that does provide information in terms of where people can be directed to for a nutritionist, which we know is very important.
Can I just add on to that, just to say, obviously, nutrition is key in anything in life, but I think that it also comes with an understanding or a realization that that is something that you need. I think that there are a lot of people in our communities who are in denial, so to speak, in regards to how good or not so good their nutrition is. And so, despite, how good or bad their health might be, they don't seek out those resources. They don't speak to their, physicians about it, or go to a physician at all for that matter. And I think that it's going to have to start with, taking account of our, our own personal health, and realizing that, hey, maybe I could be healthier. And obviously within the realm of this pandemic, everybody's health needs to be, in a focus. And so, taking the time to say, okay, yeah, I need help to start, and go to your primary care, get that recommendation from a nutritionist, or just like Vesta was saying, do it on your own. There are plenty of programs in every city, in every town, every state, that is available to the public, that can help to have a better diet, have better exercise habits, eating habits, and things of that nature.
Thank you. And as we continue to think about the increase in numbers, we haven't heard from Dr. Patrick Charles that's representing Omega Psi Phi Fraternity Incorporated. Dr. Patrick Charles, if you have anything you would like to chime in as a board certified emergency medicine physician, we'd love to have you weigh in on some of the impact or what you may be seeing, and some takeaways regarding emergency medicine. And as we allow for an opportunity for him to join in on our conversation, I want to pick up on Sharonda Johnson's comment regarding, based on the waning response of the vaccines and the variants potentially coming down the pike, do you foresee us needing to get boosted every 6 months moving forward? And I guess that also speaks to the emergency medicine specialization, but certainly we have a whole team and cadre of experts here. So someone feel free to jump in.
I definitely think that this is here to stay. I think that the COVID vaccine is going to be like the flu vaccine. You're going to need to take this every year, just like you take the flu vaccine. So get used to it, get ready for it. It's not going anywhere. I do see, because obviously this is something new. Again, we've only been in this since 2020 of March. When you think about how much has happened since March 2020, is a lot. But we do know that the antibodies that you either get because you had the COVID positive infection, or because you had the passive antibody given to you through the vaccine, they wane. So because they're not lasting as long, you're going to have to continue to keep on getting a booster to boost it back up. the same way the flu. I mean, it changes all the time. We got this Omega now. What's the next one? Is going to be down the Greek alphabet as they could create the new one. I mean, it just mutates constantly. So we have to be vigilant and stay on top of it.
Yeah, I'll just add that I share the same perspective. Unfortunately, the virus is here to stay, especially with the comments that were made before about our lack as a global society to achieve herd immunity. We're not getting close to that. So likely the virus is here to stay. As far as how long our immunity will last, a lot will depend on how much of this virus mutates and how quickly it mutates. The point's been made that we're still learning a lot about this as we go. So, depending on how much it mutates and how many more people get vaccinated, I think that will determine ultimately how often we'll need to get boosted. But we'll have to take this as it goes. We're all learning together, and we all have to protect each other as we're learning. We have to keep that in mind. Not approach it with fear, but with an attitude that we're going to learn together and protect each other as we go through this.
So what I keep hearing resoundingly coming across from our panel of experts is that knowledge is key, and our people perish for lack of knowledge. It's going to be critically important for us to stay on top of all of the trends, all of the variants, continue to read, educate, and inform ourselves, and make sure that we're not consumers of fake news, but that we are consumers of accurate information, which is why it's so critically important that this panel was convened to make sure that within our community, we are providing you with real-time, accurate information from the people that are doing the work and that continue to engage in the research and in the service that's necessary to uplift our community. Again, I want to really take this time to thank the NJPAC for making this possible, for Dr. Michael Straker, who convened this wonderful committee and panel of experts together. And on behalf of Kane University, as the Senior Vice President, my name is Dr. Sancha K. Gray, and I'm so delighted that I was able to have this time with you to talk to you about and moderate this panel of experts to talking about health and wellness in our community. Thank you again to the NJPAC for always being so timely and making sure that we stay and remain connected. I'm going to turn it over now to our NJPAC team.
Thank you so much, panel. What amazing, important information. This is a time where we have to not only be careful about our own lives, but to really love each other, we have to be careful and safe for other people's lives. And what better people to talk to than our doctors from our community? Divine Nine, you are divine. And what you do is just such an honor and a privilege to be a part of your community family. On behalf of the Coopermans, who actually have endowed the Kwanzaa celebration, so it will not go away at NJPAC, on behalf of M&T, ADP, and all of our funders, including Whole Foods, we say thank you. We honor you, we celebrate you, and we really appreciate you also for donating your time. You could be doing anything else today. And not only did you donate your time, you purchased tickets for children to actually go see the Hip Hop Nutcracker. Unfortunately, we had to cancel the show, but please know, everyone who's watching, that you can catch the Hip Hop Nutcracker on PBS, free.com. So please tune in. Thank you again. And if you are not part of the Divine Nine, you need to get in where you fit in, because they are doing some amazing work. Thank you very much for all of you being here today. Take care. Thank you, Dr. Sancha Gray. You're amazing, great moderator, and all of you. God bless you and keep you and make his face shine upon you. Have a great day, family. Happy holidays.
Great one, everyone. Happy holidays.
Happy holidays, everybody.
Holiday.